Thank you for joining today's webcast, Playing with a Full Deck, AceLift, a cutting-edge combination procedure with Precision TX and Smart Skin Plus, featuring Dr. Deborah Sarnoff. Dr. Sarnoff is a board-certified dermatologist and is one of the country's premier specialists in cosmetic dermatology, laser surgery, and Mohs surgery. Dr. Sarnoff is the senior editor of the Journal of Drugs and Dermatology and serves on the editorial board of the Journal of Cosmetic Dermatology and advisory board of the Aesthetic Surgery Journal. Dr. Sarnoff earned her BA from Cornell University and was elected Phi Beta Kappa. She graduated from George Washington University School of Medicine. May I present Dr. Deborah Sarnoff.
My name is Dr. Deborah Sarnoff. I'm a board-certified dermatologist, and I'm a clinical professor at NYU in dermatology. I've been in practice for over 20 years, and I practice with my husband, Dr. Robert Gotkin, who's a board-certified plastic surgeon. Together, we have two offices. One is in suburban Long Island, and the other is in Manhattan on Park Avenue. And we offer the full range of treatment from Mohs surgery, skin cancer and reconstruction, to surgical facelifts, which was more in the area of what he does, and the non-surgical alternatives to the facelift, which is what I specialize in. I think that going into the aesthetic field gives us the opportunity, it's a gift really, to stay away from some of the areas of traditional medicine that are being controlled, both by the government, by insurance companies, and it's a very difficult thing today for many doctors. And when you see what's going on, you say that it's better to morph and to change in ways that you can control things. By having an alternative area that you truly embrace and like to do, such as elective non-surgical rejuvenation techniques, it can give you that stream of income that is now missing from your traditional practice. Autonomy is everything. I was raised by parents. My father is an attorney, my mom, his secretary. They had their own practice, and I grew up really feeling like I like to control the way things are done. I think that when you're at a hospital, there are so many decisions, everything from the new technology that you might want that you cannot have, and I never wanted that taken away from me. I think that that's the spirit of solo practice, and it's a very sad thing for me that in many ways I think it's dying. I'm a Mohs surgeon, and I still do treatments of basal cell skin cancers, squamous cell, and melanomas in the morning. And then in the afternoon, after lunch, I change my hat, and I go into the aesthetic part of my practice, which gives me an equal amount of satisfaction, making people look better and feel better. So I think you have to be open to doing more than one thing, since times are changing, but really do what brings you joy. I have noticed the trend, particularly over the last 5 years, where many patients, and I will say especially women, and I'd say 90 to 95% of our practice is female, they don't want the invasive procedure if they can help it. I've noticed a definite trend. At the same time, we now have wonderful fillers, neurotoxins, and fantastic laser technology that has made combining these non-invasive procedures a viable alternative to the facelift. Many times, patients will pick the easier route, honestly hoping that they'll get a little bit of a pick-me-up or a tweak. Actually, people don't want to give up what they have, and they're very afraid of coming out of surgery looking like someone that they're not. So many times people will pick the procedure, if you will, that is less invasive, and it will give them a younger looking appearance and it'll make them feel better, but it won't make them look fake or plastic or overdone, which is what they fear. This is what patients tell me. They tell me they look in the mirror, they feel sad, they're looking older. They say they see their mother when they look in the mirror. And many of my patients are career women. They work. Some are men. They work. They want to stay viable in the job market. So many times, I would say a pivotal birthday, a decade birthday, when someone is turning 40 or 50 or 60 or 70, perhaps a reunion, that college reunion or high school reunion, will bring people in, or a wedding, or a second wedding, maybe even a third wedding, or a wedding of a child. And these are all happy times where patients envision themselves looking the best that they can possibly be, and they come to find out about what can they do to look better without having surgery.
I felt very comfortable with myself. I knew that doing this procedure was to make me feel better and to look better, which would inherently, it shows in your day-to-day feeling and walking around, and it was really to make me feel better. I felt good about myself. I never thought I had a bad body or ugly or wrinkly, but I knew that this would, as I said, make me feel better about myself.
I didn't want anyone to look at me and say, what did she do, or did you have something done? I just wanted to look naturally better, maybe a little bit more rested, but I didn't want any sort of commentary around, or the buzz around, what did Deb do?
Well, I think if you look at an aging female face, you can break it down into 3 different problems. The first problem, as I see it, would be sun damage or photo damage. Leathery changes, crinkles, wrinkles, particularly around the eyes, around the mouth, fine little lines everywhere. The skin often will have a lot of sunspots or age spots, liver spots, whatever you call them, dyschromia, a lot of browning to the skin, and it won't be an even, smooth canvas, and it'll have rough areas. So that's really the photo damage, looking like leather. The second thing we have to look at is volume depletion, and not everybody has it. Obese people might have more padding on the face, but if you are normal weight or thin and aging, you're going to be volume depleted. So many times, women just have not as crisp a jawline as they had when they were younger, or their cervical mental angle, which is the angle that we all love, where the neck looks as perpendicular as can be compared to the jawline. Sometimes it's not crisp. And those are the cases, I think, where the AceLift or the non-surgical procedure comes in handy. So I think all 3 things together need to be looked at. Maybe around 2004, 2005, where we had some major breakthroughs. We got the fractional ablative CO2 technology was born. We also saw the beginning of laser lipolysis, first with smart lipo, wavelengths getting better and better, and then finally the Precision TX with the 1440. So I'd say that fractional CO2 laser resurfacing and laser lipolysis really changed my practice in terms of what patients would tolerate and the results that I could truly deliver, along with neurotoxins and fillers. I had done a study originally with the Precision TX, and I deliberately chose older women older than 55, to see if it would be a viable alternative to a facelift. And many, many times it was spot on and helped tremendously. But a few times I would look at the after pictures and say, well, now they have less fat, but I wonder if I could just tighten their skin up a bit, how I could do that. And I decided, well, the answer was in my own backyard, so to speak, and that was with the Smart Skin Plus. And so the idea came about, why not try combining both to see if I could further improve what I had done with laser lipolysis. Before Precision TX, many of us did liposuction to try to sculpt the jawline and the submental fat. The problem there is that I often found that the bruising post-op made many of my patients very upset. They could not do this just on a weekend and go back to work, and that's what they were looking for. And when I first tried the 1440 wavelength with the Precision TX, I was amazed by the lack there of bruising. Patients would do it on a Friday, come back to my office on Monday, and there was very, very little bruising to speak of. The advantage to combining the different procedures, lasers injectable neurotoxin and fillers is, number one, there's a wonderful return on your investment, because now you're able to package neatly and tightly a procedure that patients actually look forward to because they are imagining already how they will look when it's completed. But there's also true synergy in combining these things. And there's a recent paper that I co-authored in the Journal of Drugs and Dermatology, September 2014, which talks about the synergy. And it's all been shown that if you want maximum collagen formation and elastic tissue, and you want to try to do the best you can on that level to bring back the spring in the dermis and to tissue tighten, then you combine these different techniques. So they all work at building collagen and elastin and making people look younger, which is what we all want. I like to do the Precision TX first and sculpt the neck, if you will, melt the fat. The patients go home with a compression dressing under the chin for about 3 days to make sure that the skin redrapes properly. A few weeks later or at a month later, then I would do the Smart Skin Plus. I like to really try to turn the energy a little bit higher on the sides of the face and under the chin. You have to be careful because, once again, the chin, under the chin in the submental area, we do not have a lot of apocrine glands. But on the other hand, I want to try to have the maximal tightening in a hammock distribution from the preauricular area under the submental and back up. And if you think about it, that mimics the SMAS. The SMAS, which is the superficial muscular aponeurotic system that is tightened in a facelift, is in that distribution. And so what I'm trying to do is to apply heat from underneath and from above without causing someone to have the incisions in front of the tragus and without giving them the surgical facelift.
I was awake during the procedure, although they anesthetized the area. So I heard them talking and do a little bit here, there. So, it was fine, and I was very pleased.
The fact that it wasn't invasive, the downtime was minimal, didn't have to take a lot of time off from work, could hide whatever it was that was going on afterwards so that I could go back to work, quicker than doing something that was more invasive.
When I start the Precision TX treatment to contour the neck, I have the patient sitting up and I look at them, and typically I'll use 4 boxes on the average neck. I'll use the template and I'll outline 5 by 5 centimeter boxes. Occasionally, for a very wide neck, it'll take 5 boxes. But I'll make that outline, and then I'll just mark where I'm going to put a tiny little nick in the submental area, and I'll mark just behind the earlobe where I might also put a tiny little nick with an 11 blade to get access. So access might be behind the earlobe for the lateral boxes and in the submental region for the more central medial boxes. Typically, for the Precision X treatment on the neck, I will use anywhere between 200 and 250 cc's of the tumescent solution. I like to actually use a spinal needle to infuse, or I will put it right in the little nick that I'm making so that I don't really have to go through the skin, but I'll use the little openings that I've made with the 11 blade to get access to be able to infiltrate. People's necks vary, and of course we look at them. Some necks have a lot of accumulated fat and you have more work to do, but on average I would deliver approximately 1,000 joules in the direction where I'm maximally heating the adipose tissue, and then I would turn my hand up to maximally heat the undersurface of the dermis with an additional 600 to 1,000 joules, depending on the patient. The typical patient, it's about a half hour to mark and to mess and to make sure that I have adequate anesthesia. Then the procedure itself might be about another half hour, and then the patient usually stays another 15-20 minutes to make sure they're fine before they leave. After the procedure, we have the dissolved fat or the lysate. In my experience, it's very easy to just have the patient supine, hyperextend the neck, and to take the handle, the syringe, if you will, and just roll it like it would be a rolling pin. And the tumescent solution, along with the lysate, the dissolved fat, comes out through the little holes that I've made in front of the earlobe and in the submental region. If you want to, you can just take a simple syringe and pull back. You can use the liposuction equipment, the very small cannula, and pull back. But here, we're not really doing anything aggressive to manipulate the fat in any kind of mechanical way. We're just drawing back to just remove the lysate. This is Irene. She's our patient today. We're going to demonstrate the second part of the AceLift procedure. The first part was using the Precision TX to take out excess fat in the neck. And as you can see, at the moment, what we have is we have a nice cervical mental angle. However, we have jowling here. We have crepiness here due to the platysma. We have a bit of banding. If you say E for me for a minute, you can see that there's some platysma banding and crepiness. And we certainly have photo damage with lentigines, and we've got that in the face as well. Around the mouth, because of the passage of time, we have a longer cutaneous portion of the upper lip, and the actual vermilion has become almost invisible. We want to enhance that a bit to make everything in proportion. And we need to, of course, address her nasolabial folds and her marionette lines. So what we're going to address is mainly the photo damage, and we're going to use the Smart Skin Plus for that. We're also going to try to increase collagen and elastin in a hammock formation to give her more of a lift, to help lift some of the neck tissue back up, and to help the jowling. So without further ado, she's been sitting for a half hour with a BLT, a combination topical anesthetic. We did not do nerve blocks, just the topical. We're going to take that off now, and first I'd like to address the filler. Then we'll move into the laser, and we'll see the Smart Skin Plus and what it can do, and I will share with you some of the settings that, in my opinion, would be correct for her skin type. And then finally, we'll use some neurotoxin at the end, because neurotoxin has been found to be synergistic in this entire procedure. We will, with the neurotoxin, put at rest the orbicularis oris muscle a bit to help that broad band of collagen come in nicely. So with that in mind, without further ado, I think we'll take off the numbing medicine and we'll get started on the fillers. So first we're going to address the ptotic cheek and try to elevate to the best of our ability. For this, I've selected calcium hydroxyl apatite to be put down on the bone. Just feel a little pressure. How you doing? Not too bad. Don't worry. Okay. I'm just going to put a little aluminum there. This is hyaluronic acid. We're going to put just a little bit more to give her a lift in the cheek and bring in moisture into the dermis. And once again, this is helping to lift. So Irene has a lot of sun damage, a lot of lentigines, solar elastosis. You can particularly see the pebbly yellowish discoloration around the mouth. She's got numerous scars from previous basal cell and squamous cell carcinoma. She's had Mohs surgery multiple times. We're going to try to improve the appearance of those scars as well with the procedure. So when you think about things, we need different settings to achieve different things. And of course, the face is full of sebaceous glands, whereas we have a paucity of sebaceous glands in the neck, and we have to be mindful of that because we don't want to have scarring of the neck. So I typically would like to give her, first of all, that hammock distribution I'm talking about to give support to the lateral portions of her face, and that will act to lift and to bring in collagen in the submental area and the lateral portions of the face and the preauricular area. I think we'll start by creating the hammock. Then we need stronger setting in the perioral area for her because that is where her solar elastosis is very prominent. The parameters that I've selected for the side of the face, we're going to, with the Smart Skin Plus, use 30 watts. I tend to like single. I don't like stacking personally. We're going to do a pulse duration of 2,000 microseconds and a pitch of 200 microns, pretty tight together. Go around the commissure. Many times, as Irene has, there's pebbly textural changes in the chin. And the Smart Skin Plus is excellent for smoothing that out, as well as the aridities around the mouth. What's really nice about the Smart Skin Plus is that you do have the controls here. If we wanted to change things, we could make different shapes when we go along the hairline. And you don't have to go back to the actual laser. You have it all here in the handpiece. I just right now want to cover the maximum territory, so we're going to stay on the square. We can keep it on the square, but we can reduce the size here and just give it a little bit extra. We just feather off. Okay, we're going to raise your brow a little bit, which is what you need. Linda, just follow me with your sticks.
Stay back here a little bit.
Smile for me, Irene. Really smile wide. Okay, that's good. In the lower lip, where the aridities emanate from.
That's all I wanted out of it, to make me feel better and to have a better profile. And that's precisely what I got.
And then I went back to work on the following Monday. And had Thanksgiving in between, had a nephew that didn't realize anything, otherwise I would have gotten a story. And so it was really very minimal appearance change, or any bruising or anything like that.
I didn't want anyone to know I had done anything. And that's exactly the result. And in fact, when I took my mom, who had a facelift done 20 years ago before she knew about this ACE, and so it wasn't an option for her then, I took her to the doctor and I mentioned that I knew a friend of his. He said, "How? You're too young to know him." And I was so proud of myself because I'm not too young to know him. I just look that way.
It made me feel more comfortable about myself, particularly if I had to do any sort of a speaking engagement or things like that. Just feeling more confident and comfortable about my appearance.
The biggest challenges in traditional medicine are trying to get water out of a rock, trying to get the third-party carriers to understand what you've done and to pay you in a timely fashion, and try to get the fiduciary responsibility on the part of the patient, getting them to understand that they may have a very expensive insurance policy, but unfortunately, there is also a high deductible and coinsurance and copays that they don't often understand or know about. So collecting the money in traditional medicine has become a difficult thing. I would tell someone to follow their dream. If they want to live in a particular place, that's where they should go first. It took me years to realize that, and I opened my Park Avenue practice secondarily, even though in my heart I probably always wanted to be in Manhattan. So I would say, number one, pick really truly where you want to be. And then I think you have to imagine your lifestyle and the whole picture. I picked dermatology because I wanted to be able to combine a lifestyle that let me live life and have a family and at the same time give good care to my patients. Today, I would say if you're thinking about an aesthetic practice, to think about the towns around you, the areas that you can draw from, and try to put yourself in an area where you think there's great potential for you. So live where you want to live and structure the practice that you want. And there are ways of taking out loans and financing equipment that used to scare me a lot at the beginning, but I have seen the return on investment over and over, and I would no longer be afraid to do that. When I choose a device for the practice, number one, I have to be convinced of the technology and the company. Too many times you hear stories of companies that are small, they're starting up, they have maybe one product or they're simply distributors, and then the product disappears or the company disappears. So I like to know that there's a company behind the machine. I like to speak to other physicians and find out, especially physicians that were involved in the pivotal studies before it was FDA cleared, to find out what problems were truly had with that technology. And so it has to be tried and true, and it has to be a wavelength that I don't have in the practice or something very special about the improvement of that wavelength to have me purchase a machine. I want a company that I can rely on. I want someone that might give me a loaner if I have a case scheduled and at the last minute I have a problem with my machine. I want responsiveness on the part of the company. If there's a technical problem, that I can pick up the phone and speak to someone right then and there. So I'm demanding, but I think that I do my due diligence and try to find the company that will stand by their products and that really truly make good machines. We did internal marketing. We made beautiful brochure with some photographs of before and after. We had our brag book in the office with more patient photos before and after. And we drew up a flyer and showed the patients what the treatments cost, what it would be to them if they just were to pick and choose, but then explained why it would be much better to have this one global fee and have the entire package under the AceLift name. So we kind of branded the name and showed them in the office through print material. And we also have iPads, and I find that the iPad is very wonderful tool to quickly show people a lot of befores and afters and to give them the nuts and bolts of the treatment so that they understand it. I would tell young doctors starting out that it's so important to get patients' cell phone numbers and email addresses, which is something that we didn't do for many years. And that's the way to reach people, to do blast email, and then the patients in your practice can hear about it. It's a very inexpensive way to reach people that already trust you. They just don't know what you do the other half of the day. So I think that's valuable. The number one do is if you're looking to have more fun in your practice and to bring new life and to feel like you're the doctor again, then do it, because it's not something you're going to delegate to your nurse or anybody in your office, not to the esthetician. It's your hands, your brain, and there's a great feeling of satisfaction at the end of the day. So I think it's a do if you think you want to use your hands and your brain and feel like the doctor again who's getting rewarded monetarily as well. I think that we're so lucky now to have the fillers, the neurotoxins, and the laser technology that we have, that we can do amazing things today that we could not do before.
This concludes today's webcast. Please stay tuned for the Q&A.